The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
I've been wearing earrings for about 13 years now, literally every single day. And over the past year, I realized I started to develop a slit, and I hate it. I want to know exactly what this is and if there's anything I can do to fix it.
She's now joined by Dr. Batra in the procedure room with an answer.
Absolutely. So, Sierra, what happens here is that this is a really common concern for a lot of women with heavy or dangling earrings. Over time, it starts to stretch out that piercing, and it can gradually travel down. Many women even will have a full split where it actually splits all the way through. But even when it's stretched like Sierra's, it's often a problem because if you're wearing a stud or a small earring, it starts to gape, it starts to hang unevenly. So our fix is actually just to repair this surgically. So, Sierra, I'm going to have you rest back. I have my assistant Cassandra here with us. And we already numbed Sierra, and she's also been prepped sterilely. We just have to cut out the old hole. And I'm going to test. Sierra, do you feel anything sharp or painful here?
No.
And you're going to be great. What we're going to do is we're going to take out the old hole, and we're going to actually slide the skin back over itself. This is called a modified Z-plasty. And the reason we don't just kind of cut this completely out and suture it back together is when it's all the way at the edge like this, it can sometimes cause a little notch in the ear that looks really bizarre and really weird. So what we're going to do first is we're just going to take out the old hole very carefully. And then we're going to cauterize with a little electric needle just to get rid of any little tiny bleeding points. And this is a procedure that can be done in the office under local anesthetic. Sierra, you're not feeling anything uncomfortable, correct?
No, I don't feel anything.
Fantastic. And
Dr.
so
B, as you said, such a common thing. In the younger patient like this, typically it's real heavy earrings over time. For a lot of the moms, like you said, the full thickness, complete tears that the kids have grabbed their ear or the earring and pulled that all the way through.
Correct. And so, you know, fortunately, this area tends to heal fairly quickly. When we do this in the office under local like this, the stitches stay in for about 10 to 14 days. We usually, if someone has pets at home or they have a history of infection, sometimes antibiotics are appropriate just to prevent any sort of secondary bacteria. But this tends to be a pretty well-tolerated procedure in the office under local. So what I'm doing now is I've actually taken out that piece, that kind of stretched out lobe, and I'm putting in one stitch just to give her a little scaffolding here and restore the structure of the ear. And then this is a really good one because we'll just put external stitches to close this up. And if you were watching closely, what I did was I actually made a little Z in the front and a little Z in the back. And that's going to allow me to slide her skin over itself and recreate the structural integrity of the earlobe. That's where the little modified Z comes in.
Just like the lip or the rim of the nose, those are key anatomic things. When you sew them, you want to make sure that you're not leaving a notch. But, you know, women love their bling. I mean, earrings have been around forever. I think the trend of anything, I see my wife in these big, heavy earrings. She loves them. I mean, you wear those over time, they are going to take a toll on your earlobes.